active we are, or how active we are, because we know that we are not very active most of the time in the country. And I always give two simple examples which highlight very well this issue, which you can have very easily in mind. Half of our population today are obese because of the non-communicable. But half of our population are obese. And we can see that this issue is not only for the nation, but it's also very well present in companies, in corporate institutions. And we can imagine how expensive it can be when we just see the health costs, which are very, very high, and a lot of productivity, which also are decreasing. Yeah, it's a major issue for our country and for our companies. Yeah, so to combat that, we have created a very straightforward ecosystem, which the first component is education, but mainly education of the personal sport and fitness trainers. Why? Because they are the only body today who has no certification. Because if you take a dietitian, a doctor, a physio, because you have a holistic approach, most of them has super schools. But unfortunately, for the personal sport and fitness trainer, this does not exist. That's why our first step was to make sure that we can create a school, which name is IWES, Institute of Wellness and Exercise Science, partnered with CTVET, National Sport Authority and Ministry of Health and Sport, to create the first of its kind accreditation so we can certify most of them. We know how important physical activity is, even for mental health. Based on that, all the professionals can sign up on our application, which looks like, I always give this example, the Uber app, because you have the professional site where the professional can register their activities. Then it can be available for everybody as a client to be able to book them, basically. This is the same solution we bring to corporate institutions to make sure that they can have the same high level of quality we give to individuals directly in their company. So they can tackle all the non-communicable diseases. Because we are very motivated by social causes, that's why we have the MYHEALTHCOP Foundation, because the goal of the foundation is very straightforward. It's how to bring health and wellness easily accessible to all, and most of the time at no cost. That's why you have every week, or at least every month, one webinar at no cost. We offer to the nation, to everybody who wants to have a proper lecture, a proper health talk, and ask any question they want. MYHEALTHCOP Foundation is there to at least propose once a year for everybody to be able to have a high quality engagement with high level professionals at no cost. So how do we do it? It's basically because we have a chance to have a business which funds basically the foundation. So each time somebody book us, part of our income goes directly on the foundation account to be able to do this type of activity at no cost. So today, it's MYHEALTHCOP Foundation with its partners who help us basically to bring this activity accessible, let's say, to everybody. And we also have a lot of chance. We also have, yeah, you can move forward. We also have the AI personal trainer, which is open for everybody, which Chief will talk about at the end of the conversation, where you can have a 1 month subscription at no cost, also funded by the foundation, to bring easy access to health and wellness, starting with physical activity. Yeah, these are the trustful organizations who are helping us since the beginning. And I want to just mention a few of them who sponsor us too through what we are trying to achieve for many, many years. In the name of Société Générale, Total, Energy, DHL Survey, Impact Life, who are trying to help us, All Mutual, Promasidor. So all of these companies are trying to support us by funding the foundation so we can bring to all of you this quality level of talk. So thank you very much. If you are here and you want to sponsor us, it's very straightforward. Just link to us, tag us, send a message in the chat, and we can attend to you so you can be also part of our partners to support this great initiative. So thank you very much. And let's move to the most important topic, which is the health talk, which is coming soon around breast cancer awareness.
Thank you so much, Chrissy, for that insightful overview. We will now turn to our main speaker for today's session, Dr. Nanama Christian, a resident surgeon in Greater Accra Regional Hospital. Good morning, Dr. Nanama. I hope you are here with us, and welcome to today's session.
Good morning. I hope I'm loud and clear. It's
Yes,
my
please, you are very
pleasure.
audible.
It's my
So
pleasure to be here this morning. Thanks for the invitation.
you're very welcome. You can take over now. Thank you.
All right. So I won't bore you with long and technical talks as we do in the clinics. So today we'll be talking about breast cancer in commemoration of Pink October, as it's commonly called. That is the month that WHO has designated to create awareness concerning breast cancer and educate the public more. So I want my helper to help me to move to the next slide. Then we dive straight into it. So what is breast cancer? So just as any other cancer, breast cancer is abnormal cell growth in the breast. So that means that the breast tissue or the cells in the breast are multiplying or they are growing in an abnormal way, not what is like the normal anatomy. So these cells multiply uncontrollably, and like every other cancer, it can spread to other parts of the body through the blood, through what we call the lymph, or by direct contact. So breast cancer, someone may be diagnosed with breast cancer, and if the person presents late and nothing is done about it, it will spread to other parts of the body. Can we move on, please? So this is a WHO statistic that they gathered. They looked at their data in 2023. That is just 2 years ago. And then they found out that breast cancer is the commonest cause of cancer deaths in women. That is about 1 in 6 cancer deaths. And if we take 4 women all over the world, 1 of the 4 women may be diagnosed with breast cancer. But in the past, in the early 2000s, late 90s up until early 2000s, it used to be 1 in 8 women. So we can see that there has been a surge, almost half, in the increase of the number of breast cancer patients we see. I must interject that, however, globally, we see over 1.7 million cases of breast cancer every year. So you can realize that that's a good number of people. And there's a number of factors that have accounted to this rise in incidence of the breast cancer. Number 1 cause is the increase in life expectancy because of modernization, improvement in healthcare. Life expectancy is increasing, and research has proven that the incidence of cancer increases with age. So therefore, if people are living longer, you get more people presenting with breast cancer as well as any form of cancer. So why is it important? Why are we here? Why are we here this morning? As I mentioned earlier, it is the commonest cause of breast cancer, and early detection saves lives. By the end of this presentation, we would see why. Early detection increases the survival rate to over 80%. So the earlier we catch it, the better for the patient, the better for the clinician, the surgeon. So who can get breast cancer? Of course, we've stated that breast cancer is common in females, but then the men are also not excluded. I like to say that anybody that has breasts is at risk of getting breast cancer, even though the incidence is higher in the females or in the women because of their biology, because of the level of estrogen hormones, progesterone hormones is significantly higher in women as compared to men. That is why the incidence in men is lower. And of course, in the elderly and in the young. So whether male, female, young or old, we are at risk of breast cancer. But the higher risk is recorded, the higher incidence is recorded in females and in the elderly patient, because as I said, the incidence of cancer increases with age. So once a patient crosses 50 years, the incidence or the likelihood of getting a form of cancer, and in this case breast cancer, is higher significantly as compared to younger. Personally, the youngest patient we've seen in our facility was about 22 years old. Yes, and then we've seen patients who are over 80 years with breast cancer and all that. But the youngest I remember is 22. We've seen a 26-year-old with breast cancer. We've seen a 28-year-old. We've seen 30-year-old. So it really cuts across the various age groups, but it's higher in the elderly and it's higher in the females. So can we move on? So this data is from the European Union. Again, they looked at their data in 2022. And then they found out that out of over 370,000 women diagnosed with breast cancer, there were about 4,400 men. And out of these 4,400 men, almost half of them died from breast cancer. I must say that the breast cancer diagnosed in men is usually, statistics and data has proven that it's more aggressive in the men than in the women. So almost half of men who are diagnosed with breast cancer, according to this data, unfortunately did not make it. So it's very important that the men also check their breast, in as much as the men are encouraging their partners, encouraging their sisters, their mothers, their friends, their enemies to check their breast. They must also check their breast as well. And we move on. So what is the cause? I'm sure a lot of us have been asking ourselves what happens. Unlike something like cervical cancer that is directly linked with the HPV virus, there is no direct link or direct cause that is linked to breast cancer. Studies have shown that changes in DNA is a number one risk factor. I'm sure some of us may have come across the BRCA1, BRCA2 gene, commonly referred to as the BRCA1 and BRCA2 genes. If it's detected in a patient's system, the person has over 80% likelihood of developing breast cancer or ovarian or endometrial cancer. And then there are some also risk factors that increase the likelihood of breast cancer. So the risk factor means that this person has a chance. It doesn't mean that if it is there, the person will get it. It doesn't mean that if it's not there, the person will not get it. So we have to understand that. So there is no direct link to the breast cancer. So we'll move on straight to the risk factors. As I have mentioned earlier, the increasing age, the older a person gets, the likelihood the person may get breast cancer. And then family history of breast cancer. If there is a first degree relative, what we mean by first degree relative is mother, sister, grandmother, auntie. These are first degree relatives. They are directly linked to you, not like extended family, your cousins, sisters, in-laws, brothers, wives. They are extended. These are first degree relatives. If there's a strong family history of breast cancer, a patient is likely to develop breast cancer. But as I said, if there's a family member, a sister, an auntie, a mom, grandmother that had developed breast cancer, it is unlikely that the person may or the person may not. But again, we've seen patients whose grandmother had breast cancer, her mother had breast cancer, and she also battled breast cancer. So it's very, very important. Family history is very important. Most of the time when people come to the clinic and we ask them, is there any disease in your family? Oh no, God forbid. It's very important. I mean, nobody wants to be terminally ill, but it's important that you know what is prevalent in your family. That will help you to inform your life choices. So if you are listening and you don't really know what is prevalent in your family, if you educate yourself, it will do you a lot of good. And women that had menstruation early, what do we mean by that? We are saying the average age for a young girl to start having her menses is around 12 years old, 10, 12 years old. So younger than that, let's say 9 years, 8 years, that means the person is at risk of developing breast cancer. Why? Because of the prolonged exposure of the body to the hormone we call estrogen. It's influencing the menstrual cycle. Or the women who have late menopause, by 50 years, we expect that 50, 52, latest 55 years, we expect that a woman should be in her menopausal period. If a woman is bleeding from her vagina after 55 years, that woman should definitely seek medical attention, and that woman is at risk of developing breast cancer, and even not only breast cancer, endometrial cancer, ovarian cancer. So if a woman, you are listening to me, you know somebody who is still bleeding of some sort, spotting after 55 years, we shouldn't brush it off. The person should definitely seek medical attention for her to undergo some investigations for us to know that everything is fine. And now obesity. Now obesity has been implicated in a lot of conditions. And in our case, because the fat metabolism also puts a positive feedback on the estrogen levels. So estrogen levels, once it's high in a patient, the person is at risk of getting breast cancer because the tumor biology is such that it has these receptors on it. So if it has estrogen receptors on the tumor and the estrogen levels are high, that means that the tumor would grow bigger and bigger and bigger. So obesity and unhealthy diet is all implicated. Alcohol. Recently, a study was published in the Lancet that no amount of alcohol is safe for the body. No amount. Over the years, different studies came up. So they did a meta-analysis. So that means that they looked at they went as far back as they could, gathered all the data on alcohol. And the conclusion was that no alcohol is safe. No amount of alcohol, whether it is 1 ml, 2 ml, 10 ml, 1 bottle, 6 bottles, whether it's red wine, white wine, green wine, beer, akpeteshi, it is not safe. Smoking is also not safe. So once a patient is addicted to alcohol or the person drinks alcohol, the person should seek help. And you may be saying that, oh, as for me, I am not addicted to alcohol. I don't drink to get drunk. Oh, as for me, when I'm about to eat that, I drink maybe something, so I take a shot. Please, that is alcoholism. Imagine every day, if you eat 3 times a day and you take a shot of alcohol before you eat, that means you drink alcohol 3 times a day, 7 days a week. That is a lot in our books. So we have to look at that. If you are trying to seek help, I'm sure the organization will be in a position to help you to get help. And radiation exposure. So there are some people who are being exposed to radiation for some reason. Maybe they are taking frequent MRIs, frequent CT scans, or maybe they are under radiation therapy for some form of cancer. Studies have shown that all this stimulates abnormal cell growth, which may predispose the patient to breast cancer or any other type of cancer. Can we move on, please? So this is what I just said. So in 2020 again, WHO looked at their data and they saw that we've been looking at, or we've been managing over 2 million cases of breast cancer. As I said, from the early 2000s up until now, the figures have doubled because there's improvement in healthcare, life expectancy is increasing, and all that. So as we can see here, about 4.3% of the patients who were diagnosed of breast cancer out of the 2.3 million was 4.3. And then obesity was linked to about 9% of the cases. So really, they also found a study and realized that 1 out of 4 of patients who are diagnosed with breast cancer really is linked with risk factors that are modifiable as compared to the non-modifiable risk factors. So we'll go on shortly to see which ones are modifiable and which ones are non-modifiable. Next slide, please. So when we say non-modifiable risk factors, it means that you can't change it. Modify is an English word to change. So once the non is, it means you can't change your gender. Let me say this again. You can't change your gender. When I say that, I mean your DNA. If you are XX, you can't change it. If you are XY, you can't change it. If you undergo hormonal therapy or any form of surgery, it's only making you feel good. But the biology with which you were born is still there. We can't, or as far as medicine is concerned, as of now, there hasn't been any biology or any intervention that has been able to alter the DNA of any living thing, whether a plant, animals, human beings. So gender, if you're born female, you can't do anything about it. If you're born male, you can't do anything about it. Your age, you can't do anything about it. Today you are a certain age. Next year you grow. Next year you grow. So those ones we can't do anything about. That's non-modifiable. So the modifiable means there's something we can do about it. That's the lifestyle changes. So obesity is a modifiable risk factor. Hormone therapy is a modifiable risk factor. I must mention also the hormonal therapy, for whatever reason, also predisposes a patient or an individual to breast cancer. So maybe the person is on contraception, maybe the person is on hormonal therapy for another reason. The person can be predisposed to breast cancer. So am I saying don't do contraception? No, that's not what I'm saying. If you want to be on contraception for whatever reason, you would have to meet with your doctors, and then the safe dose and the safe period or the safe duration for which you should take it, you would be counseled extensively on all that. But studies have shown that they are at risk. Why? Because the hormone therapy may contain progesterone, may contain estrogen, and these are the hormones that are seriously implicated when it comes to breast cancer. So let's move on, please. How does breast cancer present? How will you know, or how will somebody know they have breast cancer? So first things first, you have to know how your normal breast looks like, how your normal breast feels like. I'm not sure if we can enlarge the picture so that our audience can appreciate the labeling. I think it's large enough. So we like to liken the breast to an orange for whatever reason, but it makes it easier to communicate to our lay audience. So the changes in the skin, I'm sure we've all heard of peau d'orange. Peau d'orange is French for orange peel skin. So again, you should know how the normal breast of your skin feels like. So once you see that your breast or the breast of your partner or the breast of your friend looks like the skin of an orange peel, it is the person must seek medical help. Or you examine yourself and you feel there's something hard that feels like the seed of an orange. It's hard. It wasn't there before. I mean, the normal breast tissue, the normal breast is not one whole, let me say, ball. It's in lobules, so the breast is not a smooth organ. When you palpate, you feel some soft tissues in it. Once you palpate and you feel there's a hard lump somewhere, seek medical attention immediately. Or you wake up one day and you see that there are sores on the breast. Again, you have to seek medical attention. Or you are not breastfeeding and then you see fluid coming out that looks milky or bloody. Blood is even you should go to the hospital immediately. Or the size of the breast has changed. It's supposed to be maybe oval or teardrop in shape, but this one is not looking like the normal breast. You should seek medical attention. Or there's some veins that is visible on the breast. That means that something, blood is going into something in the breast. So we should seek medical attention. Or the pain, there's some pain in the breast. You feel, most women have breast pain when they are getting to their menses or when they are ovulating. Maybe you know what is normal for, but you realize that this pain is not really associated with your cycles, either ovulation or menstruation. So you should seek medical attention. Or this skin doesn't, you feel like there's a dimple in the breast, you must also seek medical attention. So this is a very lay person friendly picture, because the actual pictures may not be palatable for some of us. So you can have this picture of an orange at the back of your mind, and anytime you see any changes in the skin, the size, the shape, the color, you must seek medical attention immediately. Let's move on. So when do you have to see a doctor? When do you have to see us? Once you notice any changes whatsoever, size, shape, color, you should see the doctor immediately. Don't wait until it will go. Oh, it's nothing. My grandmother had the same thing and she was okay. Please see the doctor immediately. Immediately. Let's move on, please. So how do we go about this thing? So we do a lot of screening. We do the self. So the screening is in 2 types or 3 types. The self-breast examination. So you do it yourself at home. You examine your breast yourself at home. So we always encourage our patients. And whenever you are taking your bath, whenever you are dressing up, in your leisure time, it doesn't take so much time. Examine your breast and find out if there are any changes. Or if you can't do it yourself too, you can go to any health facility. And in this period, I think almost all health facilities across the nation is offering clinical breast exams. When you go there, the doctors or the nurses or the healthcare professionals, they would examine your breast and then give you the necessary assistance. And then also doing routine mammograms or ultrasounds is also another form of screening. This all helps to catch the disease as early as possible. So can we move on? So how do we diagnose breast cancer? As I've mentioned earlier, early detection is very, very important. So once we've taken a good history from the patients, why the person is there, what is wrong with the person, there's a lump in the breast, we examine and we see that there's a lump. That's a clinical assessment. Then the breast imaging, we do ultrasound or mammogram. So we do the ultrasound for the younger patient because their breasts are denser and would respond well to the ultrasound waves of the device. And then the elderly women, we use the mammogram for them. And then after we've seen a lump, because not every lump is cancerous, by the way. The fact that you've seen a lump in your breast does not mean that the person would have cancer. How would we know for sure? It's when we do the pathology. So we take biopsies of it, we take it to the lab, then we look at it under a microscope and we determine whether it's cancerous or not. So before a patient is diagnosed with breast cancer, the person must have gone through these 3 points that we call triple assessment of breast cancer. Can we move on? So what are the treatment options when it comes to breast cancer? So there's surgery. That is where we, the surgeons, come in. We take off the breast or the lump, depending on where the patient falls. Then there's chemotherapy, there's radiation therapy, and then there's hormone or targeted therapy. So as you can see, we didn't add herbal medication because as it stands now, there is no evidence, there is no research that has proven the efficacy of herbal medication in the treatment of breast cancer or any form of cancer. So these are the treatment options that has been tried and tested over the years and have been proven to help with the management of breast cancer. So let's continue, please. Okay, so as I mentioned earlier, 1 in 4 of breast cancer cases has been attributed to modifiable risk factors. That means that if the person has no family history, if the person is able to take good care of himself or herself, the risk of breast cancer is reduced. So what are some of these things we can do to lower our risk of getting breast cancer? Exercising regularly. Why? Because we said obesity has been implicated in a lot of conditions, including breast cancer. So if we exercise regularly and burn off the excess fats, it reduces our risk. And eating healthy. Why? Because if you don't eat healthy, it will lead to obesity and all that. So we have to eat healthy, maintain a healthy weight, and avoid alcohol and avoid smoking. It's very, very important. As I mentioned earlier about the meta-analysis, it stated that no amount of alcohol is safe for human consumption. So based on that, you take alcohol at your own risk. If you know somebody that is addicted and is trying to get help and is not getting, as I mentioned earlier, you go to any healthcare facilities, they'll be able to offer help, or if you, through MHC, I'm sure they would help you. No amount of alcohol is safe for human consumption. And regular screening, some of us wait till October. And I must say that it's in October that we get to see a set, because people are waiting to come and have their breast examined in October. But the screening must be regular. Once a patient or an individual is above 40 years, at least once every year or twice a year, you should get screened. And if you have a strong family history, it should be as frequent as possible. Or if you've gone to the extra mile, you've taken the BRCA test and you found that you've tested positive for it, then your screening should also be as regular as possible. So regular screening will also help reduce the risk. Shall we move on? Now we'll talk about some myths, because I'm sure most of us have heard strange things concerning breast cancer. So 1, only women with positive family history get it. It is a myth. Studies currently shows that some of the women, or now a lot more women, we are getting what we call sporadic cases. Sporadic means that there is no family history or any genetic predisposition. So now a lot more women are being diagnosed and there is no family history of breast cancer. So we shouldn't be too excited that because there is no family history of breast cancer, the person cannot get. The person is still at risk. So the person should screen regularly. Can we continue? So I just said this earlier. A breast lump always means cancer. There are lots of women who see lumps in their breast and then they go into panic mode. Hey, they have cancer, then they stay at home. Some breast may be fatty tissue, it may be fibrous tissue. All these are benign conditions. It may even be cystic or maybe fluid that has accumulated in the breast, or breast milk that has accumulated in the breast if the woman is lactating. So not all lumps are cancerous. That is why I said that before we diagnose breast cancer, the person must have gone through what we call the triple assessment. And as I mentioned, I said that how do we know for sure the lump is cancerous? We do the pathology. So until we've gone through the triple assessment until we've taken biopsy and we've said, okay, this the histology of this lump suggests it's cancer, then it's cancer. If it is not, it's not. So once there's a lump, it doesn't mean that it's cancerous. Can we continue? So there's a lot of conversations going on that men don't get breast cancer, and you saw the data from EU in 2022, 2023, that a good number of men get breast cancer. For me, I tell my patients and people I offer health education, once you have breasts, you are at risk. Someone's risk may be higher, but it doesn't mean you are not at risk. So men also get, but it's not, the number is not as compared to women, but they still get it. So can we continue? Some people believe that wearing bras, tight bras, or using deodorants can cause breast cancer. So I must say, however, that the tail of the breast extends all the way into the axilla or the armpit. So people believe that if you use deodorants, you get breast cancer. As we speak currently, again, there is no paper or no research that supports that. So for those that don't use deodorant because of that, please, we are begging you, you can go back to use your deodorants. Wear your bras, comfortable bras. It has no link with the development of breast cancer. Can we continue? And this goes on a lot, that partners sucking breast reduces the risk of breast cancer. So what reduces the risk of breast cancer? It's not just the sucking of the breast, it's breastfeeding. So breastfeeding reduces the risk of breast cancer because it reduces the level of estrogen exposure or estrogen in the woman's body. So the longer the woman breastfeeds, the lesser her risk of getting breast cancer. And by that, exclusive breastfeeding. So there are some people that are very daring and do exclusive breastfeeding for 1 year, 2 years. They are reducing their risk of breast cancer. So as for the partners, they can go ahead and suck their breast, but it doesn't offer any scientific or therapeutic advantage. It's probably just for pleasure. But as far as science is concerned and biochemistry is concerned, breastfeeding, so that means women breastfeeding babies, is what reduces the risk of breast cancer. Can we continue, please? So this is supposed to be a picture to demonstrate the breast self-examination. We've already spoken about the sucking. So I would give some, I don't know if you can all see me. I'm sure you can. The picture is not very clear. So first of all, how do we examine your breast? So you stand in front of your mirror because you are doing it yourself, so you must see. So first of all, you lift up your hands as slowly as possible. So as you are lifting up your hands, you are looking at yourself in the mirror. And normally, both breasts should come up at the same time. And when you are putting your breast down, it should go down at the same time. Then you look at the size, you look at the color, whether you can see any changes, whether you can see the dimpling or the sores, the reddening, the enlarged veins, and all that. Then we come to the examination itself. So we use this portion of our hand, not really the fingertips, so just the palm. Then you can divide your breast into four spaces, or into quadrants. Quadrant means four, so 4 sections. Then you go either in a clockwise manner or an anti-clockwise manner and check the nipples, check to see if there is any lump in the breast or if there are any abnormal changes in the breast. And once you find any change at all whatsoever, you must get help immediately. Immediately. Can we move on, please? So I'll share 2 survival stories with you. I'm sure most of us know Stephanie Benson. Stephanie Benson is the sister of Akosue Japan, formerly of Nacorex. I'm sure we know her. If you are a Gen Z and you don't know her, you can Google her. But we all know Stephanie Benson. So Stephanie Benson was diagnosed with breast cancer in 2020 and 2015. Sorry. And at that time, she decided to have a double mastectomy. And so far, it's been 10 years now, and you can see her very beautiful, very strong, and all that. So what is her message to the public? She's saying that if the decision arises to take off your breast to survive, make that decision. Don't lose your life because of vanity. And we have that's one challenge we have when it comes to our setting. There are so many myths. So when they remove their breast, their children will not love them and all that. But there are women who adopted babies they didn't breastfeed, and they have a perfect relationship. And as you can see the picture, you can see you're asking yourself, but she has had a double mastectomy. It means we removed both breasts surgically. But then there's an option available that we also call breast reconstruction. So you can see that she still has mounts on her chest. That presupposes that she still has breast. That still looks appealing in the eye. That still makes her feel good. So if the decision comes that the breast must be taken off, it would be a difficult decision, but I believe it is better to lose one breast than to lose the life in a couple of months because the cancer would spread. So let's move on to the next woman. This woman, all of us, I'm sure whether you are Gen Z, Alpha, Beta, Gamma, you know Angelina Jolie. She's a very famous actress, filmmaker. She has won a lot of awards. For her, she wasn't really diagnosed with breast cancer, but she tested positive for the BRCA1 gene mutation in 2013. And as I said earlier, people who test positive for the BRCA1 gene mutation have over 87% chance of developing breast cancer or ovarian cancer or uterine cancer. So in that same year, she had her breast removed and her tubes and her ovaries as well. So does that mean that if the person has BRCA1 gene, she will do that? As for that, there are debates. So we look at the benefits and the risks. For her, she has a lot of children, so she's at liberty to do that. So before we decide to do mastectomy and remove ovaries and all that, we would tailor the care to the individual. So since 2013 up until now, prophylactic mastectomy is gaining ground of some sort because people say, I don't want to wait, because 87 is pretty high. And when she did that, she has reduced her risk to less than 5% because, of course, she doesn't have the breast, she doesn't have the ovaries that will produce the estrogen and all that. So that is Angelina Jolie for us. And we continue. So where do you need to get help? When you notice any of the changes we've spoken about, the hospital, the healthcare centers, the NGOs, breast cancer foundations, all these are there to offer the necessary assistance and guidance. So again, not the herbal hospitals, not the shrine, not the prayer camps, but hospitals, healthcare centers. When you get to an NGO or breast cancer foundation, they will also direct you to get help at the appropriate place. Can we continue? So after all this plenty talk, what should we take home? That early detection saves lives. Stephanie Benson had her breast cancer detected early. And it's been over 10 years now, and she's still alive, kicking, very strong. I'm sure she's even stronger than some of us. And by the way, she's 55, I think, years old. So you can see. Know how your breast is. Know what is normal for you. Don't believe the myths. Anything that does not have scientific backing or any research backing it, don't believe it. You are better off seeking professional education or professional help. And as I mentioned, screening, the earlier we see it, the better. So regular screening is very important. Can we continue? So I think that brings me to the end of my presentation. So I'll pause here for some questions. So I'm sure the moderator will help me take the questions.
Thank you so much, Dr. Nanama, for that excellent presentation. You've given us a lot of valuable insights into breast cancer, and I'm sure all of us will leave here more knowledgeable and ready to educate other people on the topic of breast cancer. We will now open the floor for our Q&A session. If you have any questions or comments, please type them in the chat, or you can use the raise hand feature and we'll be happy to take them. Thank you. Hello, Harriet. I saw your hand up. Please speak if you can hear me.
Morning.
Yes, we can hear you, please.
Right. Just a quick clarity. I've heard some ladies mention the fact that the more you do the mammogram, it has some negative effects as well on the breast and all that. How true is that, please?
So thank you for your question. As I mentioned earlier, that's frequent radiation exposure increases your risk. So I mentioned some gadgets or some gadgets that give patients a high amount of radiation exposure. But as it stands now, there hasn't been any research or paper to back that. So maybe that would be a myth. Because why? We use that is the way we would see if the patient has the breast cancer or not. So different gadgets or different machines use different mechanisms to image the system or the body. So maybe if the person is having maybe a lot of x-rays, for example, or a lot of MRIs or a lot of CT scans, those ones, they can predispose. Or if the patient is having radiation therapy for some form of condition, that would also predispose. But for the mammogram, as I'm saying, there is no evidence backing that, please. I hope that answers your question.
Yes, thank you very much.
Any more questions, please?
So I've seen one message in the chat box from Adomante, and the question is, myth or fact, is there a link between breast size and breast cancer risk?
So I would say yes, I would say no, because there hasn't been any scientific evidence backing that. But rather, I would want to say that the maturity of the breast tissue reduces the risk. So what do I mean by that? Women who breastfeed a lot, because the breasts have to sort of change the anatomy a bit, grow in some way to produce the milk. So as that one occurs, it reduces the risk, but not the size per se, because we are all not the same. Some people may have very large breasts, some people may have very small breasts. That one has no direct correlation, because let us remember that I mentioned that the tumor has more to do with the biology, so the estrogen or the progesterone levels in the system, not necessarily the size of the breast. Yeah.
Okay, thank you. So, Adomante, I hope that answers your question. Okay, so we move on to the next question, and then it's from Awesome Oil and Gas Limited. Please, regarding the use of braziers, does the type with metal holding have any effect on our breast or increase the risk of breast cancer?
So again, no, they are all myths. Whether there's metal in the breast, there's cushion in the breast, there's cotton in the brazier, sorry, it has no correlation with breast cancer. So just wear a comfortable bra. That is all. Yeah. Next.
Please, are women who have not given birth at high risk?
Yes, they are. So we call them the nulliparous. So the women who don't have any children, let's say after 35, 40 years, or they had their first child at that age, they are at risk of getting the breast cancer because of, again, the estrogen exposure, because those are the hormones that are responsible for the growth of the tumor. So once a woman is, say, 40 years, 50 years, the person hasn't given birth before, the person is at a higher risk of developing breast cancer.
So the next one, what is the breast inside and outside supposed to feel like before the self-examination? Because inside the breast, if you press enough, there is a lump feeling in the middle, and I was told that
Yes.
milk before pregnancy.
That's what I mentioned earlier, that you should know what feels normal for you, and that the breast is not one smooth ball. It has what we call lobules or loops in it that produce the milk, and it's supposed to feel like soft, squishy. Shouldn't feel hard. That's why I said when you think of an orange, how the seed feels is hard. So if you feel anything like that in the breast, then you should get it checked. But however, the breast has its normal tissue. It also has fat tissue in it, and they are all soft, squishy. Maybe to put it into perspective for you, maybe if you are cooking meat, and then you see how the consistency of the fat feels, I think that can put it more into perspective for you. So maybe next time you are cooking with chicken or something, and then you see the fatty layer, you can have a feel of it, and then you see that, okay, this is normal. Maybe you have never examined your breast before. So start from today and be checking to see how normal it should feel. When that is hard, that feels like a stone, that feels like bone or something, you should get it checked.
Okay, thank you very much. So on to the next question. Juliet asks, please, what is the difference between a woman's and a man's breast?
So I would say the size, basically. The woman is designed to breastfeed. So the anatomy of our breast suits that function. That's the primary function of the breast. When you have a child, then you breastfeed. All mammals use their breast to breastfeed. But the men, however, don't breastfeed. They have lower levels of estrogen. So the size, the woman's breast is larger and more pendulous as compared to the male.
Okay, thank you very much. We'll have our next one. MFR asks, since the breast extends to the armpit area, is it possible risk of feeling lumps in that area?
Yes, sometimes we've had patients who had what we call occult breast cancer. Occult means something that's hidden. So that means it's not in the breast you can see what is in front of us, but it was in the armpit. We've had patients like that, and they've had it, and we treated them, and they are walking around. Yeah.
Okay, thank you very much. Gideon asks, what message would you share with women who are afraid to go for screening?
First of all, fear is not of God. Fear is an evil spirit. So don't be afraid. As we've learned here, early detection saves lives. So the earlier we see it, the better. Desensitize yourself of all the myths. Now, medicine has improved. So people are no longer, the rate at which people were, the mortality rates now is reducing because of improvement in healthcare and health education. So once there is a change, it's better to seek help, because another issue is if we see it late, nothing can be done about it. Once it's spread, nothing can be done, because you can't remove the brain. It's going to your brain and remove it, go into your liver and remove it, go into your bones and remove it. Do you see? So early detection saves lives. So if you want to save your life, then it's better we see it early. If you are afraid, you're only delaying. And in this case, when it comes to any form of cancer, time is of the essence. So I would encourage every woman, you may be listening and you may have some fear, some doubts. You can reach out to any healthcare facility near you, and then you get the professional advice that you need. So early detection saves lives.
Thank you very much. So we have a few more. So the next one, can one walk to a medical facility to request for a BRCA1 test to be conducted, or it must be requested by your doctor?
Yes, I'm sure by the facility they mean going to the doctor. I don't know. But yeah, every lab test you do should be requested by a doctor or healthcare professional. So you can walk into any facility and request to have it done, and it will be done. So long as it is done there. If it's not done there, I'm sure they will redirect you to the appropriate place. But it can be done. You are able
Hello, Carl.
Mr.
If you are not
Carl.
asking a question, please mute your mic. Thank you very much. So we move on to Mami Efue's question, which is a follow-up on the one about the armpits. And she asks, does it mean if a boil develops in the armpits, there is a risk of breast cancer?
No. So it comes back to what I mentioned earlier, that if you see a lump, it doesn't mean it's cancer. We have to test it. So it could be a boil in the armpits. And if the person has been getting boils, remember, boils are bacterial infection. So it doesn't really have any direct link. As I mentioned earlier, there hasn't been any direct cause that has been established, or link that has been established to cause breast cancer. So if you see a lump in your armpits or a swelling, you have to get it checked. And then if it's cancer, the appropriate treatment will be given. If it's a boil, the appropriate treatment will be given.
Thank you very much, everyone, for your questions, and also Dr. Nanama for taking your time to respond to each question.
You're welcome.
We've reached the concluding point of our session today, which is a demo on the MyHealthCop AI Fitness app, which will be done by my colleague Philemon Sapon, the Client Services and Admin Lead. Hello, Philemon. If you can hear me, please take over. Thank you.
Hi, good morning, everyone. Thank you very much, Nanaba, for the introduction. Then thank you very much, Dr. Nanama Christian, for such a powerful and insightful presentation. And then I also like to thank all our participants for making time to today's webinar. So I would like to state that we have 4 powerful webinars lined up for this month. You know, this is the month of breast cancer awareness. And so we have 4 powerful webinars that are lined up. And this is the first of the webinar series we have lined up for this month. Now, on the 15th, we have another powerful talk from Dr. Frederick Yeboah, which is on the 15th. And then on the 22nd, we have Prof. Aite, who is a professor at the School of Public Health, University of Ghana, who also take us through another insightful webinar. And then the last webinar we have is on the 29th, which will be done by Mr. Ban Secretary, who is a fiscal activity expert with MYHEALTHCOP. So please let's mark our calendars for these activities. Now, back to the presentation, I think it was a very powerful one. And then I got two main factors, right, in reducing breast cancer, what do you call it, risk. And so the first one I got was physical activity, regular exercise. And then the second one was to also eat healthy, right? So healthy eating. Now, I would like to demo the possibilities of the MYHEALTHCOP app, right? Or how we are making these factors easily accessible to each one of us here. Now, what you see on the screen is the interface of the MYHEALTHCOP app, which is available on the various stores, App Store, Play Store. You just go there, you type MYHEALTHCOP, the policeman to your health, you get a MYHEALTHCOP app. Now you go through a basic onboarding process, just like any other app. We take a few details of yourself, where after we are done with that, you get an interface just like you see on the screen. Now, as you can see, the app is able to calculate your BMI for you. I see my basic health metrics on the screen, my weight, my height, my blood type, my BMI, the ideal BMI based on World Health Organization, which is supposed to be 18.50 to 24.90. And then you are able to check your BMI trend over time. So how you're doing over time. Now you're also able to book for some popular programs we have on the app, as you can see. So the webinars that we do, we have them on the app. You can just go there and then book for these webinars. Now, if you want to eat healthy, you would need a professional to guide you, a dietitian or a nutritionist to guide you, to give you a meal plan to be able to eat healthy, right? So on the MYHEALTHCOP app, the core idea is just like the idea of boats, right? To be able to, if you want to book for the services of any professional you can think of, right? A dietitian, a personal trainer, a physio. If you want to book Dr. Nana Ama, this is available with the MYHEALTHCOP app. So just go to Explore, you go to book consultation, you see nutritionists and dietitians, you see physical activity experts, you see wellness experts. You just go ahead and click on nutrition and dietitians. If you want to book for a nutritionist, you see a list of them here. You can just go ahead and book for their services, just like both. Whether you want in-person session, you want a virtual session, they'll be able to do that for you. You select their availability, and then you can go ahead and book for these professionals. Now, on the same MYHEALTHCOP app, we have what we call bookings. So here is basically a feature for you to manage your bookings. We have scheduled bookings, completed bookings, and then if you have some bookings that are also canceled. And then we have another feature called the journal. So this is basically to help you track anything that you are doing, right? So in terms of fitness, physical activity, in terms of nutrition, food, water intake, you're also able to track your sleep patterns, right, on the MYHEALTHCOP app. We have a feature here, which is the Taliza AI chatbot. So this is basically your wellness companion. So let's say you woke up or you need any help with regards to wellness, mainly physical activity. You just go here, just like ChatGPT. You type in, I woke up today and I don't feel too well. What are some exercises that I can do, to enhance my mood or for me to be well? And then the AI is able to fetch through the repository of exercises we have to give you the best exercise or the best wellness advice based on your need. So that is the Taliza AI feature. Now, inside the MYHEALTHCOP app, this is a feature to make physical activity, which was a recommendation from Dr. Nana, physical activity easily accessible to everyone. So, we are busy professionals. We find it very difficult to go to the gym because we don't even have time. And so we are making wellness or physical activity accessible to everyone right on your phone. So you can do physical activity anytime, whenever you want, where you are. And so this is a MYHEALTHCOP AI fitness trainer. This is the interface you see if you open that. Now, the experience is such that before you begin any activity on the MyHealthCop AI fitness trainer, we believe that you have to go through what we call a fitness assessment. So we have 4 main exercises. So the first one is butterfly sit-ups. So this is for your abs or your core. We have jumping jacks, which is for full body or cardiovascular endurance. We have squats, which is for your lower body. And then you do push-ups for your upper body. Now, when you're done, you get an assessment report. So you get to see how well you are physically. So if I go to assessment report and I choose one of them, so this is a sample report you get after you do your assessment. So you get to see the overall score of what you did, right? You can check out the scoring here, how it's being calculated. And then each of the 4 exercises you did, you get to see the reps you did, the calories you burned for the exercise, the time you spent, the errors you made for the exercise, and the accuracy. If I click on errors, I'm able to see all the errors I made when I was performing jumping jacks in this case, right? I can read them so I can perform much better next time. So jumping jacks, you have all the metrics, push-ups, you have all the metrics, as well as squats. Now, after this assessment, the AI is able to put together based on your assessment results. And then when you're onboarding, you also indicate your wellness goals. So maybe I want to lose weight, I want to manage my weight management and all of that. Based on that, the AI is able to put together recommended programs for you, which is personalized. So it's based on your metrics from the assessment and your wellness goals when you were onboarding or creating your account. So recommended programs, as you can see, these are long-term programs that you can perform. So inside the recommended programs, we have weekly schedule, we have daily schedules inside the recommended programs. So day 1 in this case is total body reset. I have some exercises in there that I'm supposed to perform. Day 2 is a rest day for me after I perform these exercises in day 1. Day 3, I have shoulder strengthening all the way to day 7, which is a long-term plan for you. And then we have what we call workout sessions. So these are short-term programs that you can just do. Maybe you just woke up, you want to do some exercises before you get to the office. These are some short-term programs that you have right on your phone. And then we have a part of the AI, which is quite interesting. Which is the challenges part of the AI. Now, this part of the AI, what we are basically doing is to bring gamification into fitness. So we are trying to gamify wellness experience for all of us, mainly for individuals and then for corporate entities. So here we can actually create a challenge. Let's say MYHEALTHCOP, we want to create a challenge for women because we are in breast cancer awareness month. And so we select, say, 4 exercises that are very good for women, and then we create a challenge. Now, the challenge is such that you are able to see who is doing well on a leaderboard. So as you can see on my screen, you can create a challenge based on body parts, abs, upper body, lower body, full body. And then you can also go ahead and create single exercise challenges. So now if I create a challenge, there's a feature in here, which is a leaderboard. So this would help you to see, based on number of reps that you are doing, you are able to see who is first, second, third on the leaderboard. So basically to gamify, fitness or gamify wellness experience for us, mainly for companies. So this is the experience of the MYHEALTHCOP AI fitness trainer. Now you would ask yourself, how does it work, right? How does it train me? So let's go into how the AI is able to train you when you're performing any physical activity. So this is the experience. Before you perform any activity on the MYHEALTHCOP AI fitness trainer, you get a preview video of what you are about to do, the exercise you're about to perform. You get to see the body part you are about to work on. So in this case, I selected push-ups. You see how it's done. The body part I'm about to work on, in this case, my upper body. I have how it is done here just for you to read if you want to. Some common mistakes you could do, and then some tips for you. So I just hit on start exercise. So I have this screen. As you can see, I just go next. So this is to help me see how I'm supposed to position my phone, right? So I'll position my phone just like this behind the wall. I just go next. Then I'm going to position the phone. Yeah, so that's how it works. Now it is loading, it is connecting to my camera, and it is fetching the exercise that I'm about to do. So the feature you see there is the silhouette, the frame, and the silhouette feature. So this feature is to help you. So it captures your body. As you can see, it has captured his body. So it captures your body to be sure that it is giving you personalized coaching. So if you are doing it, it's going to capture your body. If I am doing it, it captures my body. So we have different types of body types. So now it's going to give me personalized coaching. So let's see how it works. So he's about to perform the push-up. So you can see the feature, which is the green feature you see there. Now, if he does the push-ups right, the AI is able to count for the reps that he's doing. So as you can see, he's doing it right. And so it is counting the reps for him. Now, let's say he doesn't go down enough as expected. You'd see that the AI will not count the reps that he is doing. And so it considers these reps as errors. So now let's see what will happen after he's let's just look a bit. Carl, please, can you mute yourself for me? So Carl, if you can hear me, please mute yourself. Yeah, he's performing the exercise. Okay, that was a good one. So he did 29 reps. So let's see what happens after you are done performing the exercise. So yeah, so overall he got 75%, right? So if I click here, I'm able to see how it's calculated, right? Now he did 29 reps. The calories he burnt here, 3.48 calories. And he did 7 errors. So he realized that at a point he wasn't going down as expected. So if I click on errors, I'm able to see the errors that he did. So it says align body in a straight plank position. Stay centered, no shifting. You see, so I'm able to see the errors that he did here. And then I'm able to see the accuracy of the exercise he did. I mean, he did quite well. So that is very impressive. And then if I come here, I'm able to get a history of all push-ups that I've done ever since I started using the AI. So you can see this is my account. And so this is the history of all the exercises I've performed, push-ups, right? Since I started using the AI fitness trainer. So basically you're able to track whatever you are doing over time to help you measure whether you are improving or you are not improving. So yeah, this is the MyHealthCop AI fitness trainer and the MyHealthCop, some possibilities of the MyHealthCop app. So thank you very much. I'll be glad if you have any questions for me on this. I'll be glad to answer your questions. Please, do you have any questions for me for the MyHealthCop app and the AI fitness trainer? Can the app be projected on a TV? On a TV. So now the app is for phones and tablets, right? So you can use it on your tablet, you can use it on your phone. To project it on a TV. So what I normally do, this is what I do. So what I do is just like I did today. I create a meeting link. I connect my phone to the meeting, and then I share my screen just like I'm doing. So I'm able to project on my screen using that. Now, if you're also able to cast your phone, right? You're also able to cast your phone to some smart TVs. So you can cast your phone, but for now, you can use the app on phones and then tablets, not for desktop yet.
Can I ask you a question?
Yes, please, you may go ahead.
Yeah, I saw overall exercise, what it is.
Okay, so thank you for your question. So yeah, there's a feature here that basically talks about ever since you started using the app, you see metrics that you are doing, right? So the overall exercise report here, as you can see, I'm able to see the total number of calories that I've burnt ever since I started using the MyHealthCop AI Fitness Trainer. I'm able to see the total number of exercises. So it cuts across programs, workout sessions. If I've done some challenges, if I've done some single exercises, I'm able to see all of that here in total. Now I'm able to also see the total workout time that I've done ever since I started my exercise. So what we are doing here is we are linking this to WHO guidelines. So it's for WHO. It indicates or it states that to be healthy, you're supposed to do at least 150 to 200 minutes of exercise in a week. And so you're able to see here in a week how well you are doing if you are going by the rules or the guidelines from WHO. So that is what you have here. And then overall, I'm able to see the average accuracy of all the exercises that I've performed on the MyHealthCop AI Fitness Trainer. Please, is your question answered?
Perfect.
Yeah, please, do you have more questions for me? If not, I'll entreat us all to go to App Store or Play Store. You just type My Health Cop all together as one word. So My Health COP all together as one word. You would see the My Health Cop AI Fitness Trainer. You download the app, you go through the onboarding process, and then you can have access to this amazing app, which is built by Ghanaians for Ghanaians. So thank you very much for joining us today, and it's a pleasure. And number 4, please, you may take over.
Thank you, everyone, for joining today's session. I hope you've taken a lot from the session, and I hope to see you on next week's session. Thank you very much, and have a nice day, everyone.